Dr. Funes, what is computer imaging?
Well, computer imaging is a regular computer that is attached to a camera. The camera takes an instant picture of the patient who is sitting in front of the computer and transmits it to a television screen. Then the surgeon uses an electronic pen to change the features of the patient so that he can show him the results on the screen. The screen is divided in two identical parts, the same picture on both. On one side of the screen, we will change the features with this electronic pen so that we can see the expected result on one side and the present appearance on the other. This way the patient is able to compare.
So you do this before the surgery. To give an idea to the patient.
What he can expect to have.
So the patient can see before the surgery what he or she will look like after. This must reassure the patient.
Yeah, sure, because he can see the approximate result on the screen, not the identical result.
Not 100%.
He will get a good idea.
Naturally, you advise the patient before this.
That's right. But we do explain to the patient the procedure. We have in our office documents and information, etc. But it's still difficult for a patient to visualize his final result. It's difficult. It's possible to understand an idea, but it's not easy to picture a result in 3 dimensions.
You mean unless a patient can see it on the screen, it would be difficult for him to visualize?
That's correct. It's not the same thing. It's one thing to hear that you will look better, you will have your skin more relaxed, your nose a little smaller, but it's not the same as seeing the expected result side by side.
It gives a pretty good idea finally.
Yes, a good idea. Not 100%, but a good idea.
It's relatively close to reality.
Close to reality, but not identical, because it depends on each case.
You know that there are some people who say that this is a technique to attract them, that some surgeons use this to influence the decision of the patient. What do you think of this?
Not at all. I disagree with this perception. To begin with, when patients see the result on the camera, they often decide not to proceed with the surgery because what they see is not what they expect to see.
In one context, it could influence his choice, but not positively.
That's better. It is better that this happens before the surgery rather than after. Another factor is that the computer imaging is very expensive. It takes investment in terms of time and money, and it's not easy to use. It requires a certain expertise to use it. It's not necessarily just an advantage for the surgeon, it could also be an inconvenience for him.